Right now, as you sit there watching this video, I want you to notice something. Feel the weight of your body in that chair. Do you shift slightly, searching for a position that does not make your joints ache? Do you unconsciously flex your fingers or roll your shoulders, testing how much pain awaits you today? If you are nodding along, you are not alone. And what I am about to share with you might be the most important information you have received about your joint pain in years. I am Lauren from Lauren Well Care, and in the next few minutes, I am going to show you exactly where to massage for just 1 minute to experience relief that most people spend thousands of dollars searching for. Before we dive into this life-changing technique, I want to take a moment to really acknowledge what brought you here today. You woke up this morning, and like every morning for who knows how long now, those first few moments of consciousness were not filled with gratitude for a new day, but with the familiar dread of wondering how much your joints would hurt. You probably sat on the edge of your bed for those extra precious seconds, not because you were lazy or slow, but because you needed to mentally prepare yourself for that first step, that first movement that would tell you exactly what kind of day your body was going to give you. Maybe you remember when opening a jar was something you did without thinking, when buttoning your shirt was as automatic as breathing, when walking upstairs did not require planning and pacing like you were climbing Mount Everest. Those simple tasks that healthy people take for granted have become daily reminders of what arthritis has stolen from you. It is not just the physical discomfort, though that is certainly real and overwhelming at times. It is the way chronic pain seeps into your identity, making you feel fragile and unreliable, stealing not just your physical comfort, but your confidence and sense of self. I see you there, carefully lowering yourself into chairs and praying no one notices the grimace that crosses your face. I understand the embarrassment of having to ask for help with tasks you used to do effortlessly, the frustration of planning your entire day around when the pain might be more bearable, the quiet grief of declining invitations because you are not sure if your knees or hands or back will cooperate. You have probably tried countless treatments, from expensive prescription medications that promise relief but deliver side effects, to physical therapy sessions that sometimes feel like torture disguised as healing. What makes it even harder is the isolation that comes with chronic pain. Well-meaning friends and family members suggest you just need to think more positively or try this miracle supplement they read about online, not understanding that you are already doing everything you can to survive each day. There is a particular loneliness that comes with invisible illness, a barrier between you and the life you want to live that others cannot see, but that shapes every decision you make. Here is what your doctors might not have told you, and it is something that changed everything for one of my patients, Margaret, a 67-year-old grandmother from Ohio who had been living with rheumatoid arthritis for over 12 years. Margaret came to me after years of managing her pain with a combination of medications that left her feeling foggy and tired, never truly addressing the root of her discomfort. She was skeptical, as many of my patients are, because she had tried everything from acupuncture to dietary changes with limited success. What Margaret learned, and what I am about to share with you, is that there is one specific spot on your body that acts like a master control center for joint pain relief. This is not some mystical pressure point or unproven folk remedy. This is based on legitimate medical research into how our nervous system processes and manages pain signals throughout the body. The technique I'm going to show you has been used by rheumatologists and pain management specialists for decades, but somehow this information rarely makes it to the patients who need it most. The spot I am talking about is located at the base of your skull, right where your neck meets the back of your head. In medical terms, we call this area the suboccipital region, but you can think of it as your body's natural reset button for pain management. This area contains a dense concentration of nerve endings and muscle attachments that directly influence how pain signals travel from your joints to your brain. When these muscles become tight and these nerves become irritated, which happens in nearly everyone with chronic joint pain, your entire body's pain response system becomes hypersensitive. Think of it this way. Your nervous system is like a complex alarm system in your house. When the main control panel starts malfunctioning, every little sound triggers a full alarm response. Your suboccipital muscles work the same way for pain. When they are tight and irritated, every minor joint discomfort gets amplified into major pain signals. But when you learn to properly massage and release this area, you are essentially recalibrating your body's pain processing system. Margaret was amazed when I first showed her this technique. Within just 3 days of practicing the massage I'm about to teach you, she noticed that her morning stiffness was less severe. Within 2 weeks, she was able to play with her grandchildren on the floor without wincing. After a month, she had reduced her pain medication by half, with her doctor's supervision, of course. But what impressed me most was not just the physical improvement, but the way her entire demeanor changed. She stood taller, smiled more freely, and started making plans again instead of just managing pain. Now, before I show you exactly how to perform this massage, I want to pause here for a moment because I know there are others watching this video who understand exactly what Margaret went through. If you have been living with joint pain, whether it is in your hands, knees, shoulders, or anywhere else, and you have felt that frustration of trying treatment after treatment without finding lasting relief, I want you to know that your experience matters. Your pain is real, your struggle is valid, and there are people in this community who truly understand what you go through every single day. Take a moment to comment below and simply write, "Day 1 of healing," so that others watching can see they are not alone in this journey. Sometimes the most powerful medicine is knowing that someone else understands exactly what you are going through, and your comment might be the encouragement another person needs to start their own healing journey. The technique itself is surprisingly simple, which often makes people skeptical at first, but simplicity does not mean ineffective. Some of the most powerful healing modalities are simple once you understand the science behind them. You are going to use your fingertips to apply gentle, sustained pressure to specific points at the base of your skull while incorporating slow, controlled breathing and subtle movement patterns that help release tension throughout your entire nervous system. Here is exactly what you are going to do. First, sit comfortably in a chair with your back supported, or lie down on your back with a pillow under your knees. You want your neck and shoulders to be as relaxed as possible. Place your hands behind your head, interlacing your fingers, and use your fingertips to find the base of your skull. You will feel a slight ridge where your skull meets your neck. Right below this ridge, on either side of your spine, you will find 2 small, soft indentations. These are the points you are going to massage. Using your middle and ring fingers, apply gentle pressure to these points. The pressure should be firm enough that you can feel it, but not so hard that it causes discomfort. You are not trying to force anything or push through pain. This is about gentle, sustained contact that allows your nervous system to gradually release and reset. Hold this pressure for about 15 seconds, breathing slowly and deeply as you do so. After 15 seconds, begin to make small, slow circular motions with your fingertips, maintaining that gentle pressure. Move your fingers in tiny circles, no bigger than the size of a dime, for another 15 seconds. You might feel some tenderness at first, especially if you have been carrying a lot of tension in your neck and shoulders. This is completely normal. The tenderness should feel like a good kind of discomfort, similar to stretching a tight muscle, not sharp or stabbing pain. For the final 30 seconds, continue the circular massage while slowly tilting your head forward and back, just a few inches in each direction. This gentle movement helps to mobilize the small joints in your upper neck and further releases the suboccipital muscles. The combination of pressure, movement, and controlled breathing creates a powerful reset signal that travels throughout your nervous system, turning down the volume on pain signals coming from all your joints. What makes this technique particularly effective is the timing and consistency. 1 minute is exactly the right amount of time to trigger your body's relaxation response without overstimulating the area. Doing this consistently, once or twice a day, creates cumulative benefits that build over time. Your nervous system begins to remember this state of relaxation and starts defaulting to lower pain sensitivity throughout the day. Margaret still uses this technique every morning as part of her routine, and she often tells me it is like having a reset button for her entire day. She says that when she wakes up and her joints feel stiff, she does her 1-minute massage and can literally feel her body relaxing and becoming more comfortable. She has taught the technique to her husband, who helps her reach the spots more effectively, and they have turned it into a small daily ritual that has brought them closer together. But Margaret is not the only one who has experienced dramatic improvements. David, a 52-year-old construction worker from Texas, came to me with severe hand and wrist pain from years of repetitive motion and arthritis. He was facing the possibility of early retirement because he could no longer grip tools effectively. After incorporating this massage technique along with some other supportive strategies, David was able to return to work full-time and has been pain-free for over 8 months. Lisa, a 58-year-old teacher from California, had knee pain so severe she was considering surgery. Her orthopedic surgeon had told her that her cartilage was severely worn and that joint replacement was her only option. Before scheduling the surgery, Lisa decided to try some conservative approaches, including this suboccipital massage technique. 6 months later, her knee pain had decreased by roughly 80%, and her surgeon was amazed by the improvement in her mobility and function tests. What these success stories have in common is not just the physical technique, but the understanding that healing is possible when you work with your body's natural systems rather than against them. Traditional pain management often focuses on masking symptoms rather than addressing the underlying dysfunction in how your nervous system processes pain. This massage technique works because it targets the root cause of pain amplification, helping your body remember how to regulate pain signals naturally. The science behind this approach is fascinating and worth understanding. Your suboccipital muscles are some of the most densely packed with proprioceptors in your entire body. Proprioceptors are specialized nerve endings that tell your brain where your body is in space and how your muscles are functioning. When these muscles become tight from stress, poor posture, or chronic pain compensation patterns, the proprioceptors send confused signals to your brain about the state of your body. This confusion contributes to a phenomenon called central sensitization, where your brain becomes hypersensitive to pain signals throughout your body. Even minor inflammation or joint stress gets interpreted as severe pain because your nervous system has lost its ability to properly filter and modulate pain signals. By releasing the suboccipital muscles and resetting their proprioceptive input, you are essentially recalibrating your brain's pain processing system. Research has shown that techniques targeting the upper neck and suboccipital region can reduce pain sensitivity throughout the entire body within minutes. One study published in the Journal of Manual Therapy found that just 5 minutes of suboccipital massage reduced pain scores by an average of 40% in participants with chronic joint pain. Another study in the Journal of Bodywork and Movement Therapies showed that regular self-massage of this area led to sustained improvements in sleep quality, mood, and overall pain management. What makes this particularly relevant for arthritis sufferers is that inflammatory joint conditions often create compensatory tension patterns throughout the body. When your knees hurt, you unconsciously alter your walking pattern. When your hands ache, you change how you hold your head and shoulders. These compensation patterns create a cascade of muscle tension that ultimately affects the suboccipital region, amplifying your original joint pain. By addressing this area directly, you interrupt the compensation cycle and give your body permission to relax and heal. The breathing component of this technique is equally important and often overlooked. When you focus on slow, deep breathing while applying the massage, you activate your parasympathetic nervous system, which is responsible for healing and regeneration. Most people with chronic pain spend their days in a state of sympathetic nervous system dominance, basically stuck in fight or flight mode, because their body perceives constant threat from pain signals. Deep breathing combined with gentle touch shifts your nervous system into parasympathetic mode, which not only reduces pain sensitivity, but also promotes healing at the cellular level. Your body can only repair and regenerate when it feels safe, and this technique creates that sense of safety at a neurological level. This is why the effects often extend beyond just pain relief to improvements in sleep, energy, and overall well-being. For maximum effectiveness, I recommend performing this massage technique twice daily, once in the morning as part of your wake-up routine, and once in the evening before bed. The morning session helps set a positive tone for your nervous system for the entire day, while the evening session promotes relaxation and better sleep quality. Quality sleep is crucial for pain management because most of your body's healing and repair processes happen during deep sleep stages. Many of my patients find it helpful to combine this technique with other supportive strategies for even greater results. Gentle stretching of your neck and shoulders throughout the day can help maintain the benefits of your morning massage. Simple movements like slowly rolling your shoulders backward, gently tilting your head from side to side, and doing basic neck rotations can prevent tension from building up again. Heat therapy can also enhance the effects of the massage. Applying a warm compress to your neck and shoulders for 10 to 15 minutes before doing the massage can help the muscles relax more deeply and make the technique more effective. Some people prefer using a heating pad, while others find that a warm shower or bath works well as preparation. Hydration is another crucial factor that many people overlook. Dehydrated muscles are tight muscles, and tight muscles contribute to pain amplification. Drinking adequate water throughout the day, especially first thing in the morning, can significantly improve how well your muscles respond to massage and movement therapies. Aim for at least half your body weight in ounces of water daily, more if you are active or live in a hot climate. The mental component of healing cannot be ignored either. Chronic pain often comes with chronic stress, worry, and sometimes depression or anxiety about the future. When you take time to do this massage technique, you are not just addressing the physical aspects of pain, you are also giving yourself a moment of self-care and hope. You are taking an active role in your healing rather than feeling like a passive victim of your condition. This mindset shift from victim to active participant in healing is incredibly powerful and often marks the turning point for people who have been struggling with chronic pain for years. When you prove to yourself that you can influence your pain levels through your own actions, it changes everything about how you approach your condition and your life. I want to address some common questions and concerns that people often have about this technique. First, some people worry that if the massage feels tender or slightly uncomfortable, they might be doing it wrong or causing harm. As I mentioned earlier, some tenderness is completely normal, especially when you first start. Your suboccipital muscles have probably been tight and irritated for a long time, and it takes time for them to release and relax. The key is to distinguish between therapeutic discomfort and harmful pain. Therapeutic discomfort feels like a good stretch, or like pressure on a sore muscle that ultimately feels relieving. Harmful pain is sharp, shooting, or causes numbness or tingling. If you experience any sharp pain, numbness, or tingling, stop the massage immediately and consult with a healthcare provider. Some people also worry about doing the technique correctly, especially if they have difficulty reaching the back of their head due to shoulder or arm limitations. If you have trouble reaching the area yourself, you can ask a family member or friend to help you. You can also modify the technique by lying on your back and using a tennis ball or massage ball positioned under the base of your skull to apply gentle pressure. Another common concern is whether this technique is safe for people taking pain medications or who have other health conditions. In general, gentle massage is safe for most people, but it is always wise to check with your healthcare provider before starting any new therapeutic approach, especially if you have conditions like high blood pressure, recent neck injuries, or are taking blood-thinning medications. For those of you who are currently working with physical therapists, doctors, or other healthcare providers for your joint pain, this technique can be an excellent complement to your existing treatment plan. Many healthcare providers are familiar with suboccipital release techniques and can provide guidance on how to incorporate this approach into your overall pain management strategy. It is important to have realistic expectations about timeline and results. While some people, like Margaret, notice improvements within days, others may need several weeks of consistent practice before experiencing significant changes. Your body has been dealing with chronic pain for a long time, and it takes time for your nervous system to recalibrate and for new, healthier patterns to become established. Think of this technique as an investment in your long-term well-being rather than a quick fix. The goal is not just temporary relief, but lasting changes in how your body processes and manages pain signals. This requires patience, consistency, and trust in your body's ability to heal when given the right support and conditions. As you begin incorporating this massage technique into your daily routine, I encourage you to keep a simple pain journal to track your progress. Rate your pain levels on a scale of 1 to 10 each morning when you wake up, then again in the evening before bed. Note any changes in your sleep quality, energy levels, mood, and ability to perform daily activities. Over time, you will likely see patterns and improvements that provide motivation to continue with your healing journey. Remember that healing is rarely linear. You might have days when your pain feels worse, and that is completely normal and does not mean the technique is not working. Chronic pain conditions often involve flare-ups and cycles, and learning to navigate these variations with patience and self-compassion is part of the healing process. The most important thing is to approach this technique with a sense of curiosity and kindness toward yourself. Your body has been working hard to manage pain and keep you functioning despite significant challenges. This massage is a way of thanking your body for its efforts and supporting it in finding a new, more comfortable way of being. I want to take a moment to speak directly to those of you who might be feeling skeptical about whether something this simple could really make a difference. That skepticism is completely understandable. You have probably tried many things over the years, and perhaps you have been disappointed before. Maybe you have spent significant money on treatments that promised more than they delivered, or invested time and energy into approaches that ultimately did not help. Your skepticism actually serves you well because it means you think critically about health information and do not chase after every new trend or miracle cure. That is a good thing. But I want you to consider this. What if this technique works not because it is a miracle cure, but because it addresses something fundamental about how your nervous system functions that other approaches have missed? What if your pain has been amplified all this time, not just because of damage to your joints, but because your body's pain processing system has become stuck in a hypersensitive state? What if you could influence that system through your own actions, using knowledge that most people are never taught, but that is based on solid scientific understanding of how your body works? You have nothing to lose by trying this technique for a week and seeing how you feel. It costs nothing, requires no special equipment, and takes only 2 minutes out of your day. Even if it only provides modest improvement, that improvement could be the beginning of a different relationship with your body and your pain. For those of you who are ready to move forward with this approach, I want to leave you with some final thoughts and encouragement. Healing from chronic pain is not just about finding the right technique or treatment, although those things certainly matter. It is also about reclaiming your sense of agency and hope, about remembering that your body is capable of change and improvement even after years of struggle. Every time you take 2 minutes to do this massage, you are making a statement about your commitment to your own well-being. You are choosing to invest in yourself and your future, rather than simply managing symptoms and accepting limitation. That choice, repeated daily, becomes a powerful force for positive change in your life. I also want you to know that you are not alone in this journey. The Lauren Well Care community is here to support you every step of the way. If you found value in this video and want to continue learning about natural approaches to joint health and pain management, subscribing to our channel is one of the best investments you can make in your healing journey. When you subscribe, you are not just getting access to more helpful content. You are joining a community of people who understand what it is like to live with chronic pain and who are committed to finding better ways to heal and thrive. This is not about collecting subscribers for the sake of numbers. This is about building a resource and support system for people who deserve better than just being told to take more medication and learn to live with pain. Every video I create is designed with your specific struggles in mind, respecting your intelligence and your experience while providing practical, science-based solutions that honor both your suffering and your strength. When you subscribe to Lauren Well Care, you are making a commitment to yourself and your healing. You are surrounding yourself with knowledge, support, and hope that can truly transform your daily experience of living in your body. You are declaring that you refuse to accept pain as your permanent reality. and that you are ready to explore what is possible when you work with your body rather than against it. I promise that every piece of content I share will be created with the same level of care and attention that went into this video. You will never find quick fixes or false promises here, but you will find approaches that are grounded in both scientific research and genuine compassion for what you are going through. You will find techniques that you can implement safely at home, explanations that help you understand why certain approaches work, and encouragement for those days when hope feels distant. The notification bell is also important because it ensures that you will be among the first to know when I share new techniques and strategies that could make a difference in your pain levels and quality of life. Pain management research is constantly evolving, and staying informed about new approaches and understanding could be the difference between continuing to struggle and finding the relief you deserve. I want to close by reminding you that this massage technique, while powerful, is just one piece of a comprehensive approach to healing from chronic joint pain. In future videos, I will be sharing complementary strategies including specific exercises that support joint health, dietary approaches that reduce inflammation, stress management techniques that influence pain perception, and sleep optimization methods that enhance your body's natural healing processes. But for now, I encourage you to focus on mastering this one simple technique. Give it at least a week of consistent practice before making any judgments about its effectiveness. Pay attention not just to your pain levels, but to any changes in your sleep, energy, mood, or ability to participate in activities you enjoy. Sometimes the most significant improvements are the subtle ones that gradually accumulate over time. Remember that this information is educational and not intended to replace professional medical advice. Always consult with your healthcare providers about any changes in your symptoms or treatment approach. They can help you integrate this technique into your overall pain management plan and monitor your progress. Your journey with chronic pain has probably taught you a lot about resilience, patience, and the importance of hope. Now you have a new tool to add to your healing toolkit, one that recognizes your body's innate wisdom and capacity for improvement. Use it with patience and kindness toward yourself, knowing that every small step toward feeling better is significant and worthy of celebration. Thank you for allowing me to share this information with you. And remember, your healing journey matters, your pain is real, and improvement is possible. I look forward to hearing about your progress and supporting you in finding the relief and freedom you deserve.